Get a briefing from the WHO. We take you live now to Geneva, Switzerland.
Just to build on what was discussed a little bit earlier, response to another question. So we will come up with more details on the vaccine manufacturing task force in the next few days. But what we're doing right now is working with the key partners, particularly with CEPI, also with Gavi and UNICEF, to outline what the key actions are going to be. The goal, of course, is to increase vaccine supplies so that we can scale up the vaccination programs globally and to do it as quickly as possible. And for that, we need some actions which are very immediate and short term, and that will result in immediate removal of any obstacles. And that is things like looking at the raw materials and the ingredients and the tubings and the plastic, which is getting into short supply now because there are limited suppliers of these products and the demand is clearly outstripping the supply. There are also export restrictions that have been put in place by some countries on some of these products, which is creating a problem for some manufacturers. So the first step is really to identify what those critical needs are, where there is a global shortage, and try to address them. Find either new manufacturers for those products, but also work with governments to make sure that there are no export restrictions on these products. And that's where the WTO and the trade rules would come in. The second would be really to look at expanding the manufacturing of currently available and approved vaccines. We've seen a number of manufacturers have gone out and done their own, made their own arrangements. AstraZeneca, for example, has partnered with over 8 companies around the world, but not all have done that. And so we want to try to encourage companies to do more of this type of voluntary licensing of their technologies. And this is where the CTAP comes in. So there is a link very much with the COVID technology access pool, who will work closely with the medicines patent pool that has all they have the knowledge and the experience in doing these kind of licensing agreements, which are fair, which are transparent, and most importantly, they must assure that the additional doses will go through COVAX to the countries that need them. So there has to be an equitable distribution of the additional doses that are produced. So that's why working with an intermediary like the medicines patent pool and CTAP is going to be very important. The third stream of work in this task force is really going to be expanding the basic manufacturing capacity of parts of the world, the African continent, for example, that currently have very, very limited capacity. And that will involve a number of different activities. It's going to require investment. It's going to require a business plan for sustainability. And it's going to need, of course, technology transfer, a lot of training, and so on. So that will probably take 6 to 12 months to get into place. But some of the other actions that we can take now could make a difference in the next 2 to 3 months. So it's going to be an integrated approach with immediate short-term, medium-term, as well as long-term goals and objectives, but all with the goal of increasing vaccine supplies for COVID, but also for other diseases. Africa has a huge need for vaccines for diseases that are still quite common on the continent: yellow fever, Lassa fever, and others, Ebola. So there is a huge potential for manufacturing vaccines on the continent for other diseases. And ultimately be, self-sufficient. So that really is the goal, and I think you'll be hearing more about it in the coming days. Thank you.
Thank you very much, Dr. Swaminathan. With this, we move to Ankit Kumar from India today. Ankit, please unmute yourself.
Thank you. I wanted to ask about remdesivir. Where does the WHO stand on use of remdesivir? Is there any clinical trial to show that it's useful as far as COVID is concerned? Because in India, there is a huge queue of patients to get remdesivir who cannot get it. Could you please comment on this? Thank you.
Oops, pardon. Thank you very much, Ankit, and please, Dr. Swaminathan.
Yes, I can start. And I don't know if Janet Diaz is on the call, but essentially the guideline development group of WHO did put out guidance. As you know, we have this living guidelines now, where every time there is enough evidence on a particular drug, we update the guideline. And this was done for remdesivir several months ago. Based on the available evidence, there were about 5 trials that were available at that time, of which the Solidarity trial was the largest, multi-country trial in more than 30 countries, which essentially showed that remdesivir given to hospitalized patients did not reduce mortality, it did not reduce the duration of hospitalization, and it did not affect the progression of disease from being, say, off oxygen, to patients progressing onto oxygen or the need for mechanical ventilation. Those were the endpoints that were looked at. Now, there are smaller studies that have shown in some subgroups of patients, perhaps some marginal benefit, like patients who need low flow oxygen. The NIH trial showed that perhaps there was a marginal mortality benefit, but it was in a very small subgroup of patients. The Solidarity trial, as you know, has been going on now for the last almost 1 year. And the final data on remdesivir is now being analyzed. This is going to be looking at more than 4,500 patients in remdesivir compared to the same number in placebo. So this is really a huge number. The data analysis is currently ongoing, and we should be updating those results in the next few weeks. But I refer you to the guidelines that were put out by WHO that clearly summarizes all the evidence on remdesivir. And basically the recommendation was that there wasn't enough strong evidence of its benefit in hospitalized patients. But obviously we're looking at any emerging data that's coming out and which will be then used to update those guidelines. Thanks, Mr.
Thank you very much. We don't have Dr. Diaz online, but Dr. Van Kerkhove could add.
Yeah, only very, very brief to add in about the guidelines that Soumya mentioned. We do have living guidelines out published on remdesivir. They were published in November. We currently have made a conditional recommendation against the use of remdesivir in hospitalized COVID-19 patients, regardless of their disease severity, because of a lack of evidence showing that it improves survival and other outcomes in these patients. But as Soumya has said, and as we have said for other therapeutics, we are constantly looking at the clinical trials that are underway, and these are living guidelines. So these will be updated as more data from those clinical trials becomes available.
Thank you very much. For the next question line, we come to Gabriela Sotomayor from Progresso. Gabriela, please unmute yourself.
Hola, thank you. Thank you for taking my question, Christian. One question and one quick clarification. The head of the Chinese Center for Disease Control and Prevention said that their vaccines don't have very high rates of protection. So my question is that many countries in Latin America are using the Chinese vaccines. So what is your assessment on this situation? And a very quick clarification, if may I, after my question last week, because I think your message has not been understood. Doctors who are in the first line with COVID patients have the priority to be vaccinated, regardless if whether they work in the private sector or public sector. Because in Mexico, those who work in private hospitals with COVID patients have been relegated. They have not been taken into account. So just a quick clarification on that. Thank you so much.
Dr. Kate O'Brien, please.
Thank you for the question. As you know, there are quite a number of vaccines that are being used around the world now in different programs. And all of those vaccines are under emergency use licensure with an evolving evidence base around their efficacy, their performance. And of course, those are from randomized controlled trials. And then we're also looking at evidence from the routine use of vaccines. And there is a range in the randomized controlled trials of the the efficacy of the vaccines. But what's really important to recognize is that the vaccines have all met the benchmark of what WHO established as the minimum criteria for vaccines that would be effective for use to control the pandemic. The second thing to recognize is that when you compare the results of one vaccine against another, in spite of some standardized case definitions, that doesn't necessarily mean that the case definitions were used in a standardized way from one trial to the next. So it is quite difficult to compare the specific quantitative results from one product to the next. And thirdly, the results for just about every one of the vaccines have shown that there's much higher efficacy, the more severe end of the spectrum of disease that is looked at. So each of the vaccines has had very high efficacy against hospitalization, severe disease. And then as you go down into more mild disease, and frankly, as we go down just to asymptomatic infection, for most of the vaccines, the efficacy value goes down. And so what I think is most critical here is that we are in a phase of constraint of supply of vaccines around the world. We're learning about the best use of each of the vaccines as we go forward. In particular, I think you're referring to some recent results that have come out in the past 4 or 5 days and over the weekend on the Sinovac product and some trial results, both in routine use and from clinical trials. And again, a range of values have been reported for that product, going from more mild and moderate disease to more severe disease, with again that gradient of efficacy as you go to more and more severe disease. And in this phase where we're really focusing on reducing hospitalizations and deaths and serious disease, it really is the performance against the serious end of the spectrum of disease that is most critical. So I think those are some of the sort of main points around caution about comparing across products. The fact that we're really looking at products that meet those benchmarks for that WHO set for the performance of the vaccines that would be useful in public health programs, and ongoing learning about how best to use the products that are at hand, with prioritization of the products for healthcare workers and those at highest risk of serious disease, which is really the target for protecting healthcare systems and reducing to the maximum degree possible serious disease and death.
Thank you very much for these clarifications. We'll come to the last question as I see it, for a guest we haven't had online here with us so far, and that's Konstantinos Davanis from Greek Public TV ERT. Konstantinos, please unmute yourself.
Thank you, Christian, for the question. Greece, like other European countries, has rightly started conducting self-diagnostic tests in schools and the society, so that the coronavirus transmission chains can be broken in a very difficult situation with increasing number of cases. My question, how useful are the self-tests in the strategies to reduce cases? And one question that has arisen in many countries is the management of test waste that has been done so far in test centers. Are there guidelines from the WHO on the management of this waste? Are the tests dangerous if they are positive and someone comes in contact with them? Thank you very much.
Thank you very much, Konstantinos, and I'll ask Dr. Van Kerkhove, please.
Yeah, thank you. So Bruce was just mentioning also we didn't answer the second part of the last question, which was about health workers. And just to emphasize that our recommendation for health workers are all health workers, regardless of where they are working. The recommendation is for health workers to receive the vaccination and make sure that we reach all health workers in all countries before we reach all of the populations in some countries. So thanks for just giving me a chance to clarify that. That was for Gabriela. With regards to self-testing, I think your point about waste is an important one, but let me highlight something before that. I think what is really interesting in this pandemic is that we've had really interesting innovation as it relates to testing. And this is a very exciting time in terms of the advancement in our ability to detect virus, to detect the SARS-CoV-2 virus. And so there's a lot of really exciting innovation that is out there on testing that's easier to use, that can be done by an untrained individual, by you or I, at home outside of a healthcare facility. But what we have to do is we have to make sure that these self-tests are accurate, that they're reliable, that they're quality assured, that they're easy to use, and that they perform well. And so there's a lot of tests that are on the market, and not all of them perform well. Many of them are under evaluation in individual countries. We will be assessing those as well into the future, because testing needs to be strategic in countries. The use of tests as part of controlling COVID needs to be linked to public health action. Testing for testing's sake really isn't useful. What we need is to know who has the virus so that they can receive clinical care, an appropriate care, so that they can be isolated and so that contact tracing can be carried out. And so this is really important that it's reliable. Given that we have some self-tests that are coming on the market, we need to make sure that they're assessed. But this is really important. In terms of waste, the viral load that's used in these tests that are as part of the tests are considered to be quite low. It's important to follow the manufacturer's recommendations in terms of disposal of this. As a precaution, we recommend putting it in a sealed bag before you dispose of it. But it is possible that a combination of testing can be used. I think you heard the Director General talk a lot about testing, how important that is. But I do want to emphasize that testing needs to be strategic, and we need to use all of the tools at hand. But these tools need to be reliable, they need to be accurate, and they need to be linked to public health action.
Thank you very much for these clarifications, also the add-on for the question before. With this, we're coming to the end of our question and answer session. Thank you all for your participation online and in the room. We will be sending the audio files and Dr. Tedros' remarks right after the press conference. The full transcript will be posted on the WHO website tomorrow morning. For any follow-up questions, please contact media inquiries at who.int. Now, over to Dr. Tedros for closing remarks.
Thank you. Thank you, Christian. In closing, I'd like to say a few things. The COVID-19 pandemic has shown that global manufacturing capacity is not sufficient to deliver vaccines and other essential health products quickly and equitably to where they're needed most. Earlier today, I joined several leaders from Africa for a discussion about how to increase local vaccine production. It was very encouraging to hear from the presidents of Rwanda and South Africa and also Senegal speak about the concrete steps they have so far taken to start local production. As you know, early in the pandemic, African countries came together to agree on a coordinated continental approach to the pandemic. And now they're coming together for a coordinated approach to scaling up manufacturing. Investing in sustainable and secure domestic manufacturing capacity and national regulatory authorities is critical for providing essential immunization programs and for building strong, resilient health systems against the inevitable health emergencies of the future. To address this challenge, WHO and our partners have established a COVAX manufacturing task force, as has been explained by Soumya, to increase supply in the short term, but also to build a platform for sustainable vaccine manufacturing to support regional health security in the long term. What should be done today should be done today. WHO is also ready to provide immediate technical support to assist countries in assessing the feasibility of local production and in accessing technology and know-how. I also want to express my solidarity with the people on the Caribbean island of St. Vincent who have been evacuating their homes due to volcanic activity over the weekend. According to experts, there are likely to be further eruptions, and WHO stands ready to support the government and people of St. Vincent in any way we can. And finally, I would like to wish all Muslims Ramadan Mubarak, Ramadan Kareem. Thank you.
All right, Dr. Tedros, closing that off, the WHO updating on COVID-19 vaccines and vaccination across the world, really.